Good morning.
Good morning.
It's so good to get together and talk about such an interesting topic today. My name is Wendy Goldberg, and I'm founder and president of the Benjamin Goldberg Foundation. And it's so great to be here with Dr. Sheetal Ajmani, our medical advisor, to talk about social prescribing.
Thank you so much. As Wendy mentioned, I'm Dr. Sheetal Ajmani. I'm the medical advisor of the Benjamin Goldberg Foundation. So we wanted to just get together today to chat a little bit about the foundation, the work that we're doing, and we've really been undergoing and moving into a really major initiative here at the foundation called social prescribing. So we're going to chat a little bit about that as well. But first of all, Wendy, can you share a little bit about what the Benjamin Goldberg Foundation is and how we got started?
Sure. Yes, the Benjamin Goldberg Foundation's mission is to empower and support children and family on their medical journey. And all due to the experiences our family encountered around Ben's treatment for neuroblastoma. So we were so fortunate to have a children's hospital locally here in Norfolk, Virginia, but we also traveled to Memorial Sloan Kettering Cancer Center in New York City. And during his time in treatment, we were exposed to integrated medicine. So that included for us exposure to movement therapies of dance and meditation, and also there's other modalities that surround that as well. Art therapy, writing. I mean, it's a big space, but during those times of Ben's treatment, it was really in those times of the integration of, mainly for us, it was dance and meditation that really brought our family together, really connected us in a way that I'm not sure we would have if we hadn't been exposed to that. So when we came back home, I did a lot of talking about it. And after Ben's passing, it took me a while to really decide what I would do to honor him. And, his life was so much about music, and it just felt that bringing these integrated therapies to the forefront, working with our local hospitals and health systems, was really the way to go. And we have been very successful at that, and really proud of some of the work that we have done over the last 6 years.
That's wonderful. Thank you so much for sharing your personal story and what led to us now carrying on Ben's legacy through the work that we're doing now with the foundation. And, I mentioned earlier that as a foundation, we are really moving head on into this initiative called social prescribing. But before we get to that, can you share a little bit about the work that we've done as a foundation up until this point that kind of led to this point of us now moving into this direction of social prescribing?
Sure. Yeah. And, in the beginning, when even with our board, it was a difficult conversation to say the words integrated medicine. And so we had, we really were methodical about how we were going to approach some of the work that we would do. So we are very proud of the Benjamin Goldberg Playroom at CHKD. So that is on the 5th floor hematology oncology unit. And, because of our long years of advocacy on what we now call the healing arts, there are therapies that are going through that playroom. So art therapy, music therapy, movement, meditation, and now even yoga therapy. And I do believe Reiki as well. And, we spoke so much, about the integrated therapies that the hospital's child life department, that was the name of the department that supported the children and families. And they came to us last year and she said, Wendy, we were doing so many integrated therapies, we had to change the name. So it is now called integrated care. So yeah, it's very exciting to see some of the work really come to fruition.
Yeah, it really is. Having the inside perspective as the medical advisor, it's really interesting to see. And I want to share this with everyone who's tuning in right now. Those first few years, we were really working closely with the healthcare system to bring these modalities and create these spaces for the healing arts within the hospital itself. And now we're starting to move into this initiative called social prescribing, which is really just the next step in that process. Like, we've done amazing work regionally with the local healthcare system of making these modalities, these healing arts therapies more accessible through our support of creating the playroom, the naming of the playroom, the multi-purpose room within the children's pavilion, and these spaces where now art therapy, music therapy, yoga therapy, Reiki is all being provided to patients, and some of these therapies also being open to their families and caregivers as well. And so I want to share a little bit about social prescribing and what that is and why that's the next most logical step for us to move into as a foundation to really integrate these modalities of healing even further into the healthcare systems, not only at one local hospital, but regionally within the healthcare systems and eventually nationally as well. And so social prescribing is really an innovative approach that's already being used in many countries around the world. It has not been formally adopted here in the United States yet. But there are quite a number of pilot programs already going on. And so it's an innovative approach where healthcare professionals and or trusted community members identify patients and individuals who may benefit from what we call social prescriptions. These are prescriptions for engaging in arts activities, cultural activities, time in nature, these other aspects that have been identified and known to promote healing and overall well-being. So this approach really recognizes that there is so much more to the healing and therapeutic process than what can be done in the clinic setting or the inpatient hospital setting. It really looks at a humanistic perspective and a holistic view of health and well-being. And so it's only natural then, we've done quite a bit of work to bring these therapeutic modalities within the healthcare system, and we will always support that, of course. But now to take that and expand it even further of how can we make a greater impact with this through these social prescriptions, which is really an integration of, it requires an integration of various sectors within the community, including healthcare organizations, community organizations, community foundations, healing arts therapists, as well as artists, to name just a few.
I know we're so excited about this initiative. I was invited in April of 2023 up to New York City, where they had the first ever convening, bringing together a sector. This was mainly for folks in New York City, but it was a cross section of stakeholders, medical community, it was local foundations, it was government, it was healthcare institutions, it was insurance, it was foundations. And it was really cool to be in a room with so much excitement and so much passion for bringing this to the United States. So my takeaway from my time up at Columbia was really to figure out a way to bring this here to Hampton Roads. It's really grassroots movements across the United States. So we have kind of took a big step this year and decided to do a convening in Hampton Roads.
Yeah, absolutely. Wendy came back from that meeting and she reported back to our small but mighty team. It really is just three of us, kind of, the backbone of doing all this, the behind the scenes work here with the foundation. And so Wendy, myself, as well as Jennifer, who is our executive administrator, we really could not do anything without her support. But Wendy came back and she said, we need to bring this to Hampton Roads. And so we have, over this past year, really been working hard behind the scenes to put together, to very intentionally curate a similar social prescribing roundtable convening here in Hampton Roads to explore and begin the discussions and collaborations among key stakeholders, among these various sectors that would need to come together to bring something like this together here in Hampton Roads to benefit the overall health and well-being of individuals and community and our local community, right? And here at the Benjamin Goldberg Foundation, our mission started with really working with children and impacting children and their families and caregivers. And what we've come to realize is what we call the 3 C's is we kind of think of like the sort of 3 circles, and with the child in the center, caregivers, and community. And we've come to realize that we need to address all 3 of those, right? Because all 3 of those ultimately affect each other. They're all interrelated. Yeah. And so social prescribing is a modality that helps us to do that. And there's a lot of research in some of the other nations that have already adopted this, of the incredible benefits that they have seen on the health and well-being of their communities, on a reduction in the strain on the healthcare system as well, right? So both improving the health and well-being of patients, families, and caregivers, as well as reducing the strain on the healthcare system itself. And so this is really important because here in the US, Wendy, we are experiencing a major healthcare staffing shortage all across the board, from physicians to nurses to pharmacists, just all across the board, right? And we know that that obviously is affecting the care that patients are receiving and that their families are receiving. And so this is also a modality that helps to bridge that gap. What are things within the community that we can do to support that health and well-being, as well as reduce the significant strain that is already being placed on our healthcare system? So there's just a wide range of benefits of a program such as this. And so we're really excited to be at the forefront of this, really. I was on a call earlier this week with Social Prescribing USA. That is a national organization, a national nonprofit organization that is seeking to advance this initiative nationally. And I had the opportunity, I was invited to speak and present what we're doing here in Hampton Roads with the Benjamin Goldberg Foundation at that national call, at that national meeting. And the feedback we received was just enormous, just tremendous, in support of the work that we're doing. And the medical director of that organization actually stated that we are the first region to be holding a regional convening around social prescribing, and invited us to, in fact, create a toolkit so that regional convenings like this can be created nationally all across the country. So we're really doing really incredible, impactful work at the forefront of this initiative here in the US.
I know, it's so exciting. Sheetal and I talk about this a lot, that the work and the momentum around those 2 words, social prescribing, is so big. And, sometimes we just look at each other and it's happening and it's moving so quickly. And we're just so grateful to be in these seats and to be able to swing the pendulum a little bit, or the needle in this direction. So it's really fun.
Yeah. And then we're building on that as well through our Healing Arts and Medicine Conference that's going to come up this February. So the second annual Healing Arts and Medicine Conference, the first annual was this past February, where we focused on music in medicine, which, as Wendy shared in the beginning, music was Benjamin's sort of go-to modality. And so our first annual Healing Arts and Medicine Conference, which was a conference that was open to healthcare providers as well as the general community, healthcare professionals had the opportunity to earn continuing medical education credits through this program. And so the first year we focused on music and medicine. The theme for this upcoming year for 2025 is the wave of social prescribing. And we are bringing together nationally recognized expert speakers working in this field. And so I'm really excited about that as well. So definitely stay tuned for that. Wendy, I'm curious.
Yeah.
So we have a gathering planned for this fall called Imagine Change. And we here at the foundation, we are very intentional about everything that we create, the work that we do, the words that we use. So I'm curious, as you think about the future of the Benjamin Goldberg Foundation, as the future of the work and the impact that we're having, what does Imagine Change mean to you?
Yeah, Imagine Change, I think, is our words, for our event this year. And we did change that. It was the Imagine Gala, but we really wanted to be a little more meaningful at this event this year. And I think when I think about starting the foundation and I think about what we've been able to accomplish, it was because we imagined there could be change. And I remember very early on, you know, at our local children's hospital and telling them all about the things that I saw going on at Memorial Sloan. And they were like, yeah, Wendy, that's nice. But I could just see it. I could almost see it happening. And I remember one time I was volunteering. I was on the floor with the kids and I was walking down the hall and it just dawned on me, this is the void. This is what these kids could benefit. This could make a difference. Mm-hmm. And I think the ability to imagine that something could be different really led to all of the action behind what we've been able to accomplish. So I think that inspiration that we can bring to this event and that we can share with people, that could really get behind our message and what we want to continue to do in the future.
Yeah, absolutely. Absolutely. It all starts with imagining and believing that change is possible and seeing a vision for the future that is positive and uplifting and beneficial to all. So thank you so much for sharing that. And really that is so important. And with social prescribing, kind of coming around back full circle to social prescribing and transforming the healthcare experience through the arts. As we mentioned, there isn't a formal model for this in place in the US yet. And as Wendy mentioned earlier, it's really, these initiatives in the US are really building and growing and gaining momentum from a grassroots level. And that's not to say that there haven't been pilot programs yet in the US. There have been some pilot programs that have demonstrated tremendously positive research results of the impact of this program. Specifically, the first formal pilot program was done in Massachusetts called Culture RX. And they did research as well, and they interviewed both patients as well as healthcare providers, as well as community organizations. And there were so many benefits just all across the board. But it starts with imagining that that is possible. And we here definitely believe that is possible in Hampton Roads. And that is why we're doing the work that we are doing.
Yeah, it's so important because, kind of back to what you were talking about before, the 3 C's, during Ben's treatment, I saw so much that, yes, the intention is always to help the child, or was to help the child, but the impact was so strong in the caregivers, which in many times is a family, but also the medical staff and the people around it. And then, again, the community at large. So when we affect one thing, we affect them all. And, I know it from being in those rooms during treatment and being in the hospital those long years. And, if we can make it better for one more family, then, our work is complete. It's done. And, it's so exciting to see that the response to some of the things we've done and, and what we will continue to do.
Yeah, absolutely. But we can't do it alone. We certainly can't do it alone. We are, like I mentioned earlier, a small but mighty team, really doing incredible work, making an impact regionally as well as nationally. And so we can't do it alone. I want to mention a few resources here, as well as ways that you can support us. So one is, we mentioned a few things here. One, we mentioned the social prescribing roundtable convening. That is an invite-only meeting. We will certainly share updates after that meeting, after that convening, which is this fall. The Healing Arts and Medicine Conference, please stay tuned. Registration will open soon for that. So please stay tuned for the registration link for that. As I mentioned, that's open to healthcare professionals as well as the general community. So anyone who's interested in learning more, as well as the Imagine Change event, which is happening this fall. So we will be sure to provide links to all of that. And you can also find information about all of it on our website, Benjamin Goldberg Foundation.org. And as well, when you're on the website, be sure to subscribe to our newsletter so you can get updates delivered to your inbox. What are other ways that people can support the foundation and the work that we're doing, Wendy?
Sure. We do have a donate button on the website and a support page, so donations are always welcomed. You could also reach out. We have a junior advisory council. So it is a group of young children between the ages of 12 and 18 who are supporting our work with their fundraisers and their creative ideas. So if you have young folks who are interested, please let us know. You can send an email to admin@benjamingoldbergfoundation.org.
Wonderful. Anything else you'd like to share
No,
before we
just
wrap up, Wendy?
thank you so much, Sheetal, for all your work. I can't believe you've been on board a couple years already. It's so exciting, and we are so grateful for your expertise and your approach and all your kindness and all the things that you bring to the work you do. It makes a big difference to us here at the foundation.
Thank you so much, Wendy. It's such an honor to be part of this work.
Yeah, so we again look forward to all that we can imagine together.